Of course, plenty to talk about in terms of the Brazilian variant, but we do like to mark the milestones on this programme, and another important one has been passed. 20 million people now with the first dose of the vaccine, and some additional funding coming in soon to ensure that we get all the way there to getting through the adult population, well, just as soon as possible, really.
Yes, Neil, it was an important moment on Sunday, and I have to say credit to the team who don't have a Sunday off. They don't have any day off. They just focus on continuing to deliver the vaccination rollout. We're over 20 million people with the first dose, and we're seeing good early efficacy data in terms of both vaccines, and also, of course, good data from Scotland, from Public Health Scotland, in terms of both vaccines being effective against severe illness and hospitalization. So we keep going. We're focused on the next target, which is the mid-April target to offer the vaccine to 32 million people cumulatively. That is everyone over the age of 50. And then we go on to offer the vaccine to all adults by the end of July. And I'm confident with our supplies and the visibility of deliveries that we will meet those targets.
Can we, though, talk, Minister, about this Brazilian variant? And just before we get into the 6 cases that we've identified here in the United Kingdom, just how much do we know about this variant of concern? Do we have any indication of what the effects of this variant are in terms of transmissibility, in terms of, well, you just mentioned it yourself, vaccine efficacy?
So in terms of its profile, this P1 variant is much closer to the South African variant, which we've been dealing with now for several weeks by surge testing, genome sequencing and isolation. We've had a few hundred of the South African variant, and this variant is a variant of concern. It's very similar in terms of its mutations to the South African variant. So it is concerning. There is one case who the individual didn't fill in their test card details so that we can contact them. If they would probably got a home kit or a test kit from their local authority. And what we're asking today is anyone who had a test on the 12th or 13th of February to contact NHS 119 so that we make sure we identify that individual. And of course, the 2 cases in South Gloucestershire have been isolating. One travelled from Sao Paulo through Zurich to London before the hotel quarantine came in, but they did take a pre-departure test and filled in their forms, the passenger locator form, which is why we're able to deal with them so effectively and work with South Gloucestershire Council, although there's minimal reason to believe that there may be further spread because they have been isolating correctly, but we will be doing asymptomatic testing in South Gloucestershire.
Just in terms of the effect on South Gloucestershire itself, of course, big day next week in terms of, the schools fully reopening. We understand, of course, what can happen if more transmissible variants get into places which serve as vectors for transmission. Is there a possibility that in South Gloucestershire we might not see the schools reopening on Monday?
So the way we've been dealing with the South African variant, this will be very similar in the sense that we surge test and we rapidly isolate and, of course, gene sequence. What we've done with schools is delivered 50 million lateral flow tests so that secondary schools and the teachers in those secondary schools are tested twice a week. There are 4 tests for the students as well before the schools are able to obviously fully bring children back to schools, and all that is taking place as we speak with teachers. And I want to just thank obviously the teaching profession. They've been open all the way through this second or this spike that we've had since December, because they've been teaching the frontline healthcare staff, children and those children that are most vulnerable. And the work they're doing is incredibly important. And I'm confident that we'll get all schools reopened on the 8th of March.
Sure. But just in terms of this Brazilian variant and the way in which it got into the country, we have known about its existence for quite some time. We had advice from SAGE on the 21st of January that the only way to prevent new variants from arriving here in the UK was to quarantine all arrivals. You know, the quarantine system didn't kick in until the 15th of February. Isn't it the case that if the government had been rather quicker to introduce that scheme, we might not have seen the Brazilian variant in the community?
Well, if you look at the two cases in South Gloucestershire, the case that came in from Sao Paulo through Zurich to the United Kingdom, that case followed exactly the correct procedure, which is the passenger locator form, a pre-departure test already conducted, and then isolated as well. So the regime for our borders is pretty stringent. There are other countries, and we can sort of discuss, say, for example, Australia, who have even more stringent border controls, but they still have variants occurring and have to deal with them. And the way we've been dealing with the South African variants as well.
This was an indirect flight, wasn't it? This was an indirect flight. And, you know, we've been asking questions about it on this programme. A number of people on the Conservative benches, the Labour benches, have been warning about it as well. I mean, as things stand, people from Brazil can still get to this country on an indirect flight.
So people from Brazil are banned from coming to this country, even if it's on an indirect flight. If they are UK nationals or residents, then they can. They have to fill in a passenger locator form, which this individual did. They have to take a pre-departure test, which this individual did. They then have to isolate for 10 days and take two more tests, a test after 2 days and a test after 8 days. So 3 tests in total. And I think that system in itself is robust, which is why we've been able to locate these 2 cases. And of course, the third is not linked to this, but we need to identify them as well, which is why if you've had a test on the 12th or the 13th of February and haven't had your result back, please get in contact with NHS 119.
I suppose the problem with all of this, Minister, is, you know, people were warning about vague, porous quality at our borders. We had the Health Secretary on the programme on the 4th of February, and I said this, when we still didn't have a date for the quarantine hotels. As things stand, with the controls we have at the border, with no date for the hotels, isn't it the case that there is a possibility a new, potentially dangerous variant could arrive here in the United Kingdom, bypassing all of the security you've mentioned? Mr Hancock went on to say, you know, we've got very stringent measures in place. The Brazilian variant got here. The stringent measures clearly weren't enough.
So, and that was what I was really trying to get at when I mentioned the Australian border protocols and regime, or New Zealand, that people often quite rightly refer to as sort of best examples of how to do things. They still have challenges with variants actually getting in, and they still have to surge test, do the genome sequencing and isolate in the way we've been doing with the South African variant. I think if you look at this case, actually, if anything, it says that our border controls are pretty robust, because the individual did have a pre-departure test. They did have the passenger locator form, which is why we were able to...
And we've still got one somewhere, potentially, in the community yet to be identified.
Yes, and that's why we need to make sure we find that individual. And we have, obviously, data points that we're going to try and make sure we locate them. And, of course, the reason that we're asking the media to help is to, if anyone who's been tested on the 12th or 13th of this month, of February, forgive me, to come forward if they haven't had their test results back, because the one bit they didn't fill in is their test card, which has their contact details.
Just in terms of what we're expecting this week, of course, big week for the Chancellor, and as always happens, you know, we could spend, 20 minutes speaking to you about what's in the papers this morning, and we're all going to be told we have to wait till Wednesday. So just philosophically, as someone who has a keen interest in business, what do you want to see from the Chancellor this week? I mean, the OECD, the World Bank, the IMF, all suggesting that now is not the time for tax rises, particularly on businesses. What's your view of that?
Well, I think it's important for all of us to wait. It's only another 48 hours till the Chancellor is on...
I'm on tenterhooks, Minister. Come on.
Well, look, I can tell you one thing that I know the Chancellor has been telling business quite rightly, is that our strategy for the recovery from this unprecedented challenger for the COVID pandemic is three-tiered. One is infrastructure, so a big focus on the infrastructure bank and investing, in big amounts of billions of pounds into infrastructure, especially green infrastructure. The Prime Minister, in his 10-point plan, set us a target that by 2030, every home will be powered by offshore wind. So there's a big push on infrastructure. The second is skills. And you look at the Kickstart scheme, 120,000 places have been created for those who are probably most vulnerable to the COVID challenge, the youngest people who are on the employment ladder or getting on it.
Sure. But just in terms of the corporation tax, and I know you're not going to answer this specifically. But look, you've got any number of companies at the moment looking at whether or not to relocate themselves so that they have better access to the EU market. It's obviously happening. Why would we give them another reason to want to leave the country in the form of a hike in corporation tax?
Well, as I said, look, I can't comment on any taxation announcements, as you can imagine, not least because they would be market sensitive. And of course, it's right that the Chancellor delivers his budget, as is traditionally done, on the 3rd of March, so not long to go. But what I would say is that this country is eminently investable. You look at, in terms of our skills base, our knowledge base. We've demonstrated it obviously through the discovery of the vaccines. And I think this is a great place to come and invest, which is why we still attract, you look at fintech, financial technology, we still attract more investment in this country, I think, than the whole of Europe does in fintech, or at least we're on the top, before someone calls me up on it, the top of the league in terms of attracting fintech investment to the United Kingdom. So I'm very confident that as we come out of this COVID challenge, the economy will bounce back and will be incredibly dynamic, not least helped by Rishi Sunak's budget on Wednesday.